Ognito is India's #1 clinical voice AI solution. And I thought it'll be nice to start off with just a very quick video.
Colon complaints of lower back pain, full stop, new paragraph, technique colon MRI of the lower dorsal and lumbar spine was performed in the sagittal and axial planes using T1 and T2 weighted sequences. Full stop additional scan cuts were taken, full stop, new paragraph. Findings colon, medium size central focal protrusion is noted of the alpha S1 disc connecting the thecal sac and descending S1 nerve, full stop. Additional scan cuts reveal deformity of the left posterior elements of the alpha S1 vertebra with pseudoarthrosis, full stop, new paragraph. Conclusion colon, new line, loss of lumbar lordosis, full stop.
Wasn't that fascinating that, within 30 seconds, an entire complex clinical document can be done? And I think Dr. Shabnam just before me had mentioned that, in telemedicine, one of the issues is, collecting the information at source, because that information really is the power that you'll be able to use for analytics, for clinical research, for all these type of things. So, the clinical document is a very, very important part of healthcare. And that's really the problem that we've been solving and how we've been able to really grow, in India and across the world. Just a brief history about us. I actually started my first company when I was 19, which was ScribeTech, which was the first medical transcription company in the NHS in the UK. And, that really is the place where we cut our teeth and we learned, the craft. And it was during this period, that we started investing in very advanced R&D, actually working with leading professors from MIT in Boston, Sheffield University in the UK, and IIT Bombay as well. And we were able to develop, what today is one of the very few clinical speech recognition engines in the world. So I believe there's only maybe 4 or 5 in the world, including, companies like Amazon. Then we incubated this new startup, which is Ognito, around 2019. We were actually trusted by, 180 customers all over the world. And really with the leading hospital groups in India, you can see Apollo, Max, Medanta, even AIMS. And, it's got a huge amount of acceptance, because at the end of the day, this is a technology that really will drive EMR adoption, right? Because you can actually get the clinical documents inside your systems done really, really fast. And it integrates really across the continuum of care, and is very powerful. Now I'm going to just show you another very quick video, which will show you our latest technology in actually creating a prescription really, really fast. And I want you to notice in this video that it's not just using speech recognition. It also is using natural language understanding, which is very sophisticated, using AI to basically automatically structure the clinical document. And then that structure would be used, ahead for analytics by the hospitals.
Start note. Fever and headache since last 3 days. Family history of diabetes mellitus. Allergic rhinitis. COVID-19 pneumonia. RT-PCR. Monitor SpO2 daily. Tablet azithromycin 500 milligrams twice a day for 5 days. Add code.
So as you can see here, there's several levels of, AI technology being used on top of the speech to text, right? So you're able to very quickly do your speech to text, but then it understood that, the statement fever and headache since last 3 days was a chief complaint. COVID-19 pneumonia was the diagnosis. And then you could also do the SNOMED CT and ICD-10 codes right there. So this is really showing you the power of a lot of the very acute problems where doctors were finding it very hard to sit and fill this information out in the electronic medical record. This is really the problem, that we have addressed. So now I'm going to take you on to the next part of the presentation. The first one was just giving you a bit of context of who we are and what we do. But this very fascinating area of voice biomarkers is something that we're working on from an R&D perspective, and we believe it has huge potential. One of the most powerful use cases, I would say, is mental health, right? That how can you use technology like this to actually drive better outcomes in mental health? So you see the statement here right in front of you. Our brain regions and our muscles are all connected, right? And all this impacts our voice, right? So actually within the voice, there are actual biomarkers which could tell you, if someone was depressed, etc. So if you look here, in mental health, as you can see, all these feature correlations are there inside a person's voice, right? So you can imagine the energy variance, energy velocity, if someone has a jitter in their voice, a shimmer, these are very unique pieces of information, that AI can pick up. But I would say that humans are also very good at picking it up. I'll give you an example that if you're on a work trip and you call your mother or you call your wife up, from home, from the work trip, and they would, within a second when you're speaking to them, know if you were feeling low or if you were feeling, tired, right? So that is a voice biomarker. Without you having to say, I'm feeling low or tired, someone can understand. And AI has become very, very good at doing this. And you can see even areas like schizophrenia, the amount of feature correlation that exists. So this is a very fascinating technology for mental health. And we believe that the use cases for this really are going to be, to begin with, as a triaging technology. So you could imagine there's a technology on an app and, someone talks within it and it could pop up saying that, look, you've got, potential, some type of, depression or schizophrenia. And, this could then be sort of advised to go and meet a doctor. So as I said, it can be used for triaging and very powerful technology at that. Again, this is a huge problem. There's a 27% increase in major depressive disorders since 2020. And I think, after COVID, it's really skyrocketed. But you can see the numbers here, the ages 18 to 24. It's just ridiculous, the amounts of, how much this is actually impacting youngsters, right? And, since the pandemic, very big increase in the cases of these disorders. This is certainly an area that we're working on, but there are also areas like pulmonology and many neurological based areas as well, which have these unique features and has the ability to use AI to be able to, or rather voice AI to be able to detect this as a tool. Very much like how you have your imaging or your MRI scan, or you have something like this. In the future, you'll see that voice will become a very cheap and scalable technology that can help you diagnose disease. I'm going to take you to this area, which is another very fascinating, which is really the ability to detect Parkinson's disease, right, which is a neurological problem. But, Parkinson's, even till date in 2022, people need to do a physical examination, to see, if a person has Parkinson's, right? And 1/4 of these diagnoses are wrong, right? So that's a very, very big problem because, it's a physiological type of thing that needs to be done. And, you can probably say that this is possible or probable that you have, Parkinson's. Today, I think there's a PET CT that is done, which gives you some information, right? And, this is where we're looking at that voice can also be used as a tool, really, to be able to, diagnose this in a much faster way. Sure. So, we're already working with rural India. There's actually a, fascinating entrepreneur that we've been working with. He was a cancer sufferer. And he actually set up, it's called the Dijiswasthya Foundation, and he goes into rural India and, they do a lot of the teleconsults. And we've actually been working with him and supporting him. So it's fascinating to see that our technology is working even in the rural sort of parts of the country. And, this was more a sort of CSR type of thing that we've been working on. But I think, we have to work with the government, to be able to really make this technology available across the country. Today, obviously, we're in the tier 1, tier 2 type of cities. But we're starting to see, especially I would say in radiology and diagnostics, that area, ultrasounds, that we're starting to see a lot of traction, even inside certain rural centers and stuff like that. Yes, this is, I think, a big issue that needs to be addressed. It's a great question that, we are underinvesting in technology, right? Of course, you can try and sort of do it. I mean, I think the costs of EMR systems in the States and all are really ripe for disruption because it's ridiculous. If you take an Epic system in the USA, one Epic system can cost a hospital like $100 million, right? And that would never sustain in our country. I mean, it's just ridiculous to pay that much money for software. But at the same time, it's very important to invest a lot more than we are, to try and get the best type of systems. Because today, I like to say that, if you really believe that data is the new oil, right, in a digital world, then this healthcare data, is healthcare's oil, right? And be it the government or be it the private sector, it's very important that you actually are able to capture high quality documents and information, right? So it's just important to make these investments, and I think we need to, as a community, keep pushing to to make those investments. But I think we're clearly seeing that there's a big uptick in EMR, and especially with the National Digital Health Mission. It's almost going to be like the UPI moment in fintech, right? When the UPI came in, lots of innovation, lots of things opened up. And I think, with this infrastructure that's coming in, you will see an explosion of innovation happening in the country. Our technology is actually 99% accurate, and it can deal with any accent anywhere in the world. It's completely agnostic of accents. The accuracy levels have actually surpassed human accuracy now. And especially if you think about it, there's so much complex terminology that it's always by the AI being updated. The latest drugs are being updated. So you can imagine that, you're actually, if you see the sort of cases that we've done, and the white paper, we've actually said that there's an increase in quality once you start using this technology. Because as I said, quality at source is the thing. The doctor can actually sit, explain, use the most complex terminology, and it always comes out accurate. So, we're 99%, and, with the way that AI is going, that's only going to increase and improve. Firstly, we perform, way better than Google. Google doesn't have a medical speech recognition currently, so that's the reason we perform better than them. But in the States, Amazon Medical Transcribe has been launched, and even there, we're performing at a much better level than them. So, our background of 21 years of being in the clinical documentation space has really helped us. Since we've launched in India, our accuracy levels are much, much higher, for the Indian accent as well. So I think we had mentioned we're in about 24 states, but I think actually, we're beyond that. I think we're in, about 27 now. And that's never been the issue. I think you can even throw a Chinese accent at it and you'll get the same level of accuracy. Currently, the technology is very much in English. And I think in healthcare reporting today, it's all in English. But we are working on vernacular as a tool, for the doctor to be able to explain the report, say, for example, in Hindi or Marathi or Gujarati, whichever language, right? So, for the patients, right, to understand the report, some level of translation can be done. And that is an area in R&D for us. But as it stands today, it's completely in English. And we're focusing on English-speaking markets, like the US, UK, Australia, etc., and the Middle East as well. Some patients find it difficult to explain their symptoms. Can VUI help in them moving forward? Great question. Excellent question. And it's something that we are looking at from the patient perspective. But again, it's in R&D because we need to, we've got so many projects on that we have to sort of focus on it. But I do see that, the VUI is going to help, because if you look at it, say for example, from a biomarker perspective, if a patient can talk inside the app, right, and it is able to actually diagnose. Think about it in the future. I've only spoken about 2 cases, right? But as this technology keeps advancing, maybe you'll be able to detect a heart attack from the voice. Maybe you'll be able to detect, lung issues from the voice. And I know that today, there's technology out of Israel which is able to detect COVID just from your voice with a very, very high accuracy, something like 85%, which is higher than rapid antigen test. So, the technology is fascinating in the whole diagnostic space, and, we're really enjoying working on it. But, more importantly, we believe that just the scale of this, being able to put a diagnostic technology on an app, means that you can get to hundreds of millions, even billions of people with this technology. So, it is going to play a very important part, the VUI.